to my YouTube channel. I am Dr. Qais Abu Ali. I'm very glad to be here with you. My goal today is for you to hopefully know a little bit about me, what I do and why I do it, but also for me to know a little bit about yourselves, the viewers, the community, as you share with us your comments, your thoughts, your questions, and perhaps what you'd like to learn more about in future episodes. So please post your comments below, subscribe to this channel, and be at liberty to like these clips. I graduated medical school from the University of Jordan back in year 2000, and then moved to the United States for my advanced medical training. I completed internal medicine training in Detroit, Michigan, Henry Ford Hospital, and then completed a fellowship in clinical genetics at the National Institutes of Health, NIH, in Maryland, and then completed a second fellowship in molecular genetics at the NIH as well in Maryland. So my practice after that was really a combination of clinical practice, diagnostics practice, and therapeutics practice. And what I mean by that is I started seeing patients in the clinic in genetics across various age groups: pregnant females, pediatric age group, and adults. What I see in the clinic is basically patients who have a known genetic disease or a confirmed genetic disease, or a suspected genetic disease, or perhaps they have a family member who has a genetic disease or inherited disease, and they want to ask about their risk of having or acquiring or inheriting that disease. So the scope of practice in clinical genetics is really broad. So I see patients in the clinic with, for example, chromosome abnormalities, and one of the common conditions is Down syndrome. I see patients with various birth defects, congenital defects, a missing digit, or an abnormality in their lip, a cleft lip or a cleft palate, for example. I see patients with various metabolic diseases, or what we call them inborn errors of metabolism. We might not necessarily know as a community some of these terms, but in practice we do know that as a people. So for example, if you look at the soda can, there is a warning regarding patients with phenylketonuria or PKU. So as a community we're exposed to that, but we don't really think about genetic diseases as part of our lives. So I see patients with those kind of inborn errors of metabolism in the clinic as well. I also see patients with what is called mitochondrial disease, abnormalities in their mitochondria, or the engine that produces energy in our systems. I also see patients who have cancers and inherited cancers that most of us know about. For example, breast cancer, where there is specific mutation or alteration in specific genes that get passed on from parents to their offspring. So I see those patients and various other groups of diseases that I end up seeing either as a diagnosis or as a confirmation or as genetic counseling and a follow-up plan and treatment afterwards. So that's the first piece of my clinical practice. The second part really has to do with the diagnostics or the molecular genetics. What I mean by molecular genetics is looking into the genes and the DNA itself. So I worked on analyzing various genes and various rare diseases and common diseases, reviewing those mutations, reporting those mutations, helping patients understand what those mean, and helping other physicians understand what those mean. The third part of my practice really is in clinical trials and drug development. And what I mean by that is I advise pharmaceuticals and biotech companies and groups and design for them clinical trials and clinical studies for various diseases, mostly rare diseases and ultra-rare genetic diseases. And most of those do not have treatment yet. So I help them in designing their protocols and being a monitor for those clinical trials, make sure that safety is maintained and kept, and then analyze these data and help them present these data to the health authorities, to the scientific community, and to regulatory agencies, so that in the end we can get those drugs approved. So as you can see, I help patients and providers understand genetic diseases from the clinical end into diagnosis, into potentially having a treatment. Many of these patients with genetic diseases end up spending years and years and years trying to find an answer, and once they get to an answer, that leaves a huge void in their lives, and their next step really is trying to understand what can we do about that, what kind of treatment would there be for that. So part of my job is to try and explain to them what clinical trials we can have them consider or be considered for and get enrolled in. I'd be happy to answer questions as patients, as scientists, as physicians, healthcare providers. Any questions, any comments, any thoughts you might have. If you have any thing you'd like to share, please feel free to post that in the comments. I'll be including my work email, Facebook page, and also you already know this channel. So until we meet next time, stay well, stay safe.